Hey, and welcome back to Psych Nurse to continue our small snippets of Psych Nurse. What have you got in your toolkit? I like the little at the end. I don't know why, but anyway, I'm going to do it. So, look, we've talked about listening skills, we've talked about therapeutic communication, and we've talked about psych nurses not being non judgmental. So, I guess that sort of takes us into nicely with our next tool, which is the ability or the skill or the tool necessary to educate the public with issues around mental health and trying to reduce that stigma down. You're never going to get rid of it, but you've got to try and reduce it. And that stigma sort of is embedded in the patient, it's embedded in their families, and it's embedded in the general public. And it is slowly coming around. And, probably, as I've already said in the previous blog, that, the main mental health presentation to any GP is depression. So, mental health is kind of becoming more of a norm as such. If norm is the right word. Anyway, correct me if you think I'm wrong. So anyway, educating the public. So what can we do as psychiatric nurses? Of course we can promote mental health and we can try and dispel some of those myths. And when we're talking to public and when they ask you what you do, and sometimes people won't tell about what they do, and then the immediate reaction is that, oh, what's the gory bit? Has anybody tried to kill you? No one hasn't tried to kill me actually. I did get punched by a very old gentleman who was suffering with Alzheimer's, ex-boxer. But would I say that was a dangerous job to have? No. I wouldn't say it's a dangerous job to have. I probably got just as much chance of being punched in the street by somebody that didn't like the way I was driving, or I indicated too soon, or not enough, or or I was going too slow, or going too fast, or I didn't see them coming around the corner, that sort of stuff. So you've got more chance of getting hit by someone with road rage. I think perhaps the risks are more prevalent because to the outside public, the risks seem higher. But, I probably reckon I've had more run-ins at the local pub when someone's been intoxicated than I have in a mental health unit as such. So there's the tool. It's about education. It's about promoting mental health. It's about making patients feel that they haven't got anything that is so terrible that they can't discuss it. It's about educating families to be not scared of it and probably embrace it and look for those signs that will help them understand what the illness is, the symptoms of the illness, what the illness can bring to somebody's everyday life, and helping them get around it by offering support. And not only that, for the patient, reducing stigma and helpfulness, but also for the organisation, because the organisation is often the thing that gets highlighted in the press. You see it, a schizophrenic man kills ordinary person walking down the street. What will mental health service doing about it? Well, people that are in the mental health service know what we are doing about it. And is the mental health service system, or is the mental health system service perfect? No. But I don't know any profession that is perfect. It's always looking for ways to improve itself. Anyway, that's enough of a rant. I just wanted it to be a snippet. So, psych nurses, you have got the ability to educate people. Go out there, go forth, and go do it. Hey,